I'm Amy, and I'm here with my friend Buck, and we're here to talk about putting some fun back into our dysfunctional lives. When I first got diagnosed with MS, I really didn't even have like a regular doctor. I just used to go to I call them the doc in the box, the freestanding clinics, because I was a pretty healthy person and I just didn't think I needed a regular doctor. So then I went deaf in one ear and I was dizzy all the time. And don't make any dizzy blonde jokes because enough people did that. And then I started to I had double vision, and that was like, okay, something is really wrong. And so I went to an ear doctor. That was my first stop because I thought about the deafness. So and he did some stuff, and he said you have something called sudden nerve deafness, and I was like, what the hell is that? And so he sent me for an MRI and the neurologist. And that was my first like regular doctor was the neurologist. And he told me I had the otologist said you have multiple lesions in your brain. And I was like, I'm dying of brain lesions. What the hell is that? So then when I thought about it later, I was like, oh, multiple lesions, multiple sclerosis, because lesions are scleroses. That's what those are. So and then I got it. And then and I really liked my first neurologist. He was the one who, he said it's MS, and I didn't understand what MS was at the time. And I went, so how long do I have? This is a nightmare. And he goes, no, you don't understand. You're not going to die of this. You might want to die of it, but you're not going to die of this. Not your age expectation with MS does not decrease. That's one of the things that's kind of a fallacy about MS is, you die of symptoms of MS, but you don't die of MS. So anyway, so that was my first, and I really liked the guy. And then then I ended up, okay. No, and I did get a regular doctor, and I had a series of interns, and I finally was like, I just can't. I need a resident. I need, a doctor that's always there. So then I got that. And mostly my doctors are great. So I really like my dentist who's retired. I think I have to find a new dentist. I really like my new neurologist because my old one, my first one was Kovaleski. And now my second one is Katznelson. It's like all my doctors have to start with the K and have weird names. So, and I really like Katznelson too. He's great. And then I finally got a really good doctor that I liked, and then she left, so I had to get a new one of her. But I like my GP is good, and I have an eye doctor, an ophthalmologist instead of just an optometrist, because I have optic neuritis, which is something that a lot of people with MS have. So I can't just go to a regular ophthalmologist because they don't, not a regular optometrist. I have to go to an ophthalmologist. So, and the only doctor I ever actually wanted to just like throw under the bus was my first pediatrician for my kid, because he just wouldn't listen to me. He acted like I knew nothing, And that's what I appreciate about all the doctors I have right now is they treat me like I understand my health, and they ask my opinion, and they listen to me, and they don't treat me like I'm an imbecile, So
Yeah, it's Canada has a problem with doctors leaving.
yeah,
I'm lucky that my HIV doctor is a doctor who runs the research through McGill all
yeah,
across Canada. So actually, when I moved, she was able to just give me a doctor in Toronto, in Quebec City, in Vancouver, because they meet with her and they're on they do these big conferences together and conference calls all the time and stuff like that. So
yeah.
I'm part of a research study. So
Mm.
they're able to just keep track of me. Now I'm going through, being assigned a social worker, which took a while. And they were like, so who was your social worker before? And I said, nobody ever gave me one. So this is a whole new thing. And then today I met with her, and she mostly does psychiatry, therapy, stuff like that, but she doesn't do the financial part of it,
Mm.
which you need a caseworker to
Right.
do and I don't understand in the US they don't really, I mean, in Chicago I had a caseworker, but that
Yeah.
was through the
Howard
AIDS
Brown.
Foundation of Chicago.
Yeah. Oh,
So
okay.
she helped me maneuver. She was really great. Um,
Good.
she had depression. So when we'd meet, we'd
So
talk
she
about,
understood.
I was like, what's going on with you? So and sometimes she would call me and we would just chat. That's a good person to have on your side. In Chicago, I went to Howard Brown, which is
Right.
this big conglomerate of HIV offices, and oh no, we don't do finance here. You have to go to this office downtown and go to that office. And they're like, oh no, we don't do that. I was like, oh my God, you're
Yeah.
so huge, you don't even know who
Who
does
does
what.
what? Yeah.
So I said, you're defeating the purpose, which is to make life easier and less
Right.
stressful for somebody with HIV. And then the whole insurance thing in the US, this covers this, but this doesn't cover this. So does you have
Right.
Medicare, but Medicare only covers this. So you're going to do a copay. I never did a copay before. Why do I have to do that? Blah, blah, blah. And the whole thing of being dropped by Blue Cross. Finding a doctor, actually, we were talking today with my social worker about my past history of going through therapy and psychiatry and stuff. Like who was the best, who was not really that great.
Yeah.
People seemed kind of, like you said, they're interns or they're residents or they're whatever like that. And that gets really frustrating after a while because I don't want to tell my story again and again
Right.
and
Right.
again. And I want to say, here's a pamphlet. There you go.
Yeah.
Like Stephen King should do a pamphlet on what Maine looks like so that he doesn't begin every novel with in Maine, blah, 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 blah.
Yes.
This part of Maine and the mist comes over. I don't care.
Yeah.
It's Maine. I got it. I've read your other books. I got it.
Right.
Well, I don't want to tell
Like,
the story of my life again to
yeah.
somebody who's new or filling in for somebody, or they have to do a rotation because that's part of their education. It's like I'm tired of that.
Yeah. Well, yeah, I had that same thing, right? For my first GP, I got an intern, and then he left, obviously, and then I got another one, and then I was like, this is not okay. I need somebody stable that's going to be there. I mean, and then I got a resident, and then she left anyway. So, it happens. And same with, then I got a doctor I really liked, and then she left that practice and went to Glenview, and I guess I could follow her there, but it's totally not convenient. And the place where I was going, the clinic I was going to is like a couple of miles.
Yeah.
So I went ahead and got another doctor at that practice, and I like him. I don't like him as much as I liked her, but
Yeah.
I like him. And the other thing that I've been very fortunate about, and this is not typical at all, is my doctors actually talk to each other when they need to.
Yeah.
So my neurologist will call my GP or my eye doctor if there's a necessity. When I had the shingles, I know they were all talking to each other, which is really nice. Treatment planning together. I just think that doesn't happen.
Yeah, it doesn't. We only take care of this, so you're gonna have to go
Yeah.
to this doctor. You're gonna
Right.
Then you kind of report back, and it's like,
Yeah.
well, yeah, he didn't really seem to know what was going on.
Right.
So I had to tell him all again. Tell him everything again. I had to recap
Right.
everything. It's like I just get tired of that.
Yeah. Yep.
I know that they have a lot of patience, and I know that there's a lot to do referrals for and figure this out so you can have the information to give to your patient. But that's a lot of work. It's not just meeting them in the office. It's they're going through your file and
Right.
talking to the other doctors or specialists or whatever that you need. So when I meet with Canadian doctors, I actually get a lengthy session where we get to talk about everything. And I
Right.
get to bring up all kinds of stuff. And because I know that I'm probably not going to see them for another 3 months. So I'm going to try to get everything out. And the great thing about where I go at McGill is that they have a nurse's station. So if I'm sick, I can just show up.
Right. That's nice.
You call, but if you're really, really sick, they want to get you in there. And it's nurses and physician's aides, but they have a doctor on that does the rounds too.
Right.
They're residents.
Nice.
They're not interns, they're residents. So
right.
That's part of their
So they're not
education.
leaving anytime. They're not just going to cycle off. They're going to stay for a while.
And they have a great cafeteria.
That's very nice.
Which is really nice. It's a whole new, it's a newish building.
It's new facility.
Got this beautiful view of Montreal and
Yeah.
a giant stethoscope outside sculpture, which is
Cool.
really cool. But
That's neat.
nothing like the sound of that cafeteria tray just sliding down the.
Yeah.
every home should have a cafeteria.
I think so.
Yeah.
It's just so nice.
I know. Well, that's what I treat. I treat myself to either, and they have
Yeah.
burgers and stuff and eggs
Oh,
and all
cool.
that, Swedish meatballs.
Yeah.
Have
It's
some of
not
that.
like all just healthy
Yeah.
muffins
No,
or
they do
something.
have really healthy stuff
Oh,
too.
sure.
They
But
do
they
have
have
good
good
stuff
stuff.
too.
Yeah.
But it's actually really nice. And the thing about going to a place like that, McGill, is it is also a hospital. So
Right.
when they refer you, it's not, for the most part, it's not, oh, here, I'll put this fax through and I'll refer you to. No, it's like, so go over to radiology
Right.
or go over to podiatry, go over to surgery, go over to,
Nice.
you know,
Yeah.
so like go over to, get your endoscopy done.
Yeah.
It's like you can just have it done. You don't have
Yeah.
to actually wait for the other doctor to call
Yeah.
you and say, "Oh, can you come in on?" Sometimes you do, but most of the time you
Right.
don't.
Mostly it's just all
Yeah.
right there. That's nice.
Oh, you have something in your lungs. All right, I'm going to send you to radiology right now.
Yeah.
So, it's great because the doctor isn't a separate doctor and he doesn't have to have the equipment in his office.
Right.
So just go over there.
Yeah.
So, and they just call over and you're expected and you do it and you're done.
Yeah.
You get to go to the cafeteria.
Yeah. That's nice. Yeah. My GP, they do have, I mean, they definitely had the lab there. So you don't have to go somewhere else to get your blood drawn because I know there are places that don't even have blood draw,
Yeah.
so our labs. So, and then my neurologist has they're attached to a hospital, so there's all kinds of stuff there, right? And the MRI, whenever I have to have an MRI, they have an
Oh, they
MRI
do?
in that building. Yeah,
Wow.
I mean they still have to make an appointment. They can't just go like, here's an order, go downstairs and get an MRI because
Right.
so you have.
Right.
But it's there in the office in the building, so that's nice.
That's great.
Yeah, it's always nice to know there's my
Yeah.
brain is still in there.
Well,
So,
I also
yeah, I'm like,
today with my social worker, I was talking about dentistry because I said now, supposedly beginning January in Quebec, they have subsidized dentistry.
good. Wow, that's nice.
So some of it is subsidized, meaning some of it's just free.
Right.
So, and she didn't know anything about that. And I was like, so am I actually going to get, I liked her a lot, but am I
Good.
actually going to get a social worker who knows about financial stuff? So I meet the psychiatrist again next Wednesday. So I'm going to see if she can give me somebody that I can actually talk to about
Yeah.
how do I sign up for this? How do I, because I need like $5,000 worth of stuff done to my mouth, and
Yeah.
it's not like I mean, it is cosmetic, but
Yeah.
it's
I mean, it's cosmetic because you need to
it's
that's
essential because
yeah
these
essential.
things are very raw and sensitive now,
Yeah.
and they could get infected. And I don't want
Yeah.
to go through that. And I was telling her the story of how Jersey Shore Medical, they used to have dentistry, which they don't anymore, for people with HIV, because a lot of the people in that area were, it's Asbury Park and Neptune, and it's like poorer areas. So
Mhm.
a lot of drugs. So they're HIV, they're drug users. So
Yeah.
intravenous drug users. So they found that using the school of dentistry, for them to practice on these
Yeah.
people
Yeah.
is, and they were really good,
Yeah.
is beneficial to the person with HIV because it, first of all, you are less likely to get an infection through your mouth
Yeah.
because everything is capped and, good.
Yeah.
Also,
Taking
you present yourself better, so you're more likely to get a job and be social. So you're less likely, Dr.
to relapse.
You're
Yeah.
less likely to redo drugs,
Right.
to fall back into it. Once your mouth is good, you kind of get, because it's a process. It's not like a
Hmm.
one-day thing. You have to go back and go back and go back and back
Right.
because they are students. So they do one procedure, one procedure, one procedure. So I said to the social worker today, and I've said to my doctor at McGill, Dr. Kawhi, I said, why? Because I know you have a school of dentistry because I walk by it.
Right.
It's like, why aren't we the guinea pigs for these, because
Yeah.
we're more likely to get, the infection you get in your mouth is more likely to spread if your immune system is
Compromise.
at risk. So if it's lowered.
Yeah.
So I don't understand how these people are not all connected.
Yeah. They
Especially at
should.
a teaching hospital. Do you go to a teaching hospital or is it
Yeah.
just, yeah.
No, I did actually. When I was in the last time for that, I had cellulitis in my
Oh,
leg.
yeah.
It was really painful and awful. But and I told that story about my roommate and all that stuff. But yeah, they would bring like rooms full of, here come the students, and there's no dignity in the hospital. I'm here, and
Yeah.
I asked them if I could just wear my own, clothes or my own gown, like
Yeah.
just as long as they could have access, as long as it was just like a flowy kind of nightgowny thing, they let me wear it because I hate those
I know.
hospital gowns so much. They're just so ugly and uncomfortable. And so I'm in my own gown and everything. But here come all the students. And I just said, hello, students. And then, as he was doing he's talking to me, and I kind of would look at him and I'd be like, questions for me, whatever. And then when they left, I said, good luck.
I had an intern once, actually at McGill, and she didn't really seem to know what HIV was.
Oh,
So
really?
she told me it was I mean, she did, but she didn't
Yeah.
know like how you get it, all the other stuff that goes with it, the additional infections, how an infection can make you, a person with HIV, like really, really sick. And I don't know. She and I talked for a while. And I said, well, she goes, this is just a rotation thing to see what I like, And I said, well, if you're going to do this, you really need to talk to Dr. Klein and really start to
Yeah.
really delve into this because you're a straight woman,
Right.
and so most of you are going to deal with are gay men and HIV drug users, and I'm guessing you're from a good family.
Yeah.
She's like,
And never
well, I
been around
guess.
people. Yeah.
They paid. I said, I guess they are paying for all of your education. These are people who, the drug users are people on the street. They're people who are
Right.
barely making it. They're in some sort of housing or halfway housing. I said, you need to understand the psychology of the whole
Of
thing,
course.
you
Yeah.
know, because they're
Yep.
not using drugs for fun. They're using drugs to escape the
No,
demon.
to just like be able to like function in the world.
Right. And you're
Yeah.
going to say, well, why did you go back and use? Well, you have a
Be in
really
my
hard time
shoes for a while.
understanding that.
Yeah.
Yeah, you have a hard time understanding that. So,
Yeah. Well,
I don't know.
you have to think about this too, is that the student doctors are learning things like anatomy and, um, just body functions and that kind of stuff. They're not learning like pathology and stuff like that yet.
Yeah.
And because one time I, I avoided hospitals for years. The only time I'd been in the hospital, up till a couple of years ago was, or I guess it's been more than that now, but was when I had my kid
Yeah.
and I was in for the C-section. So, and then I hadn't been in hospitals. And then one year I was in like three different times. And the one time, uh, they sent me in, I can't even remember what it was for, but I guess I was having an exacerbation that was bad enough that it landed me in the hospital. And, the intern came in and said, and I was on, whatever drug I was on, like I think I was on Tysabri, which is the one where you can get that PML thing I talked about
Yeah.
one time ago, and and what can make it even worse is if you're on a drug, or you're already on the drug that can have that as a side effect, and if they put you on prednisone, the increase is exponential. It's bad.
Yeah.
So here's the intern, and she says, we're going to put you on some prednisone, and I went, you are not, because it is counterindicated with the medication that I'm on right now. And she was like, you can see her like going, ooh,
Yeah.
I was like, I'm advocating for myself because I'm 100% sure that I knew way much more about MS than she did.
Yeah.
Than, all the stuff it could do and how it occurs. And, because she was just doing her GP routine, rotation in the hospital. So she didn't know things like that. So you have to be able to advocate for yourself too, and
Yeah,
tell
because
people.
you're in charge of your own healthcare. When I would do little
Yeah.
seminars in New York with
Yeah.
younger gay, wannabe leather guys, stuff like that, I said, you are in charge of your own healthcare. If you don't speak
Absolutely.
up, they're not gonna know it. They're gonna give you the minimum of
Right.
what you want. The minimum. I said this to the social worker that I met with today.
Yeah.
That Canada has great healthcare. You just have to be dying.
Yeah.
So, like when I had my hernia,
Yeah.
I really wanted to get it repaired before I moved to Chicago, and it was coming. I literally started texting them every day that I couldn't move, that it was very painful to do this and that. And
Yeah.
that.
Yeah.
Total lie. But within 2 weeks, I got an appointment, and somebody
Right.
had canceled, and they put me in, and I was done.
Yeah.
And she was really great. She did a lot of extra stuff in there too to get the little hernias. Teaching hospitals are valuable, but it's great to have a real like surgeon or doctor who
Yes.
specializes
Sometimes.
in that area, and they've been doing it for years. And like Dr.
Right.
Klein did research. When I was in New York, I went to Columbia Presbyterian because I had alopecia.
Yeah.
So little spots of hair would fall out and stuff like that. And I told you this story, but I'll tell it again. So it
Right.
was a teaching hospital, and I went to get the shots. You get steroid shots in your head, kind of steroid cortisone. I'm not really sure what it was. I knew at the time, but here comes this whole trail of students in,
Yep.
and I'm bent over and I'm showing the spots, and the doctor says, "Who can tell me what this is?" Now, one of them spoke up, and I said, "Alopecia areata." And he goes, "Who said that?" And I said, "I did." He goes,
Yeah.
"And what causes it?" And I said, they don't really know, but they think it's stress. Whatever, it could be a stressor from something you're taking into your body, or it could
Yeah.
just be life is stressful. So, psychologically. So they didn't know how to treat it. And he just like was like, "Get out." He said, "Get out." He goes, "Want to be a dermatologist, my ass." And he just threw him out, and then he gave me the shots. And I said,
Yeah.
"Wow, these are the future dermatologists." And he goes, "I know, it's scary, right?" He goes, "You can talk and talk at them, and they don't take it in. They just want to be a doctor. They want to have a high salary. Do they want to learn? No, but this is part of their education." And I was like, "Yeah, I know. I get tired of being a guinea pig." And even nurses on rotation, because they rotated from there to Gayman's Health Crisis, where my main doctor was at.
Yeah.
And I was getting these testosterone injections in your butt, and like usually they're great. And
Yeah.
so you actually lean up against this bench, which is next to the wall, and you pull down your pants. And I had this woman who was Asian, who she was older, and this was a new thing to her to be rotated. And she goes, "Oh my god, I forgot the vial." So she
You
leaves.
can't really get the medication without the vial.
She leaves the door open with my butt
With your
hanging
butt
out.
hanging out. Yeah.
So I went over and I closed it. She goes, "Oh my god, this is the wrong one. Okay, I'll come back." And I was like, "She gave me a shot and I got a bubble, which
Oh, I
hurts
hate that.
hell because she missed the muscle."
Yeah.
And I was
Yeah.
like, this and I said to the head there, I said, "This nurse rotation thing, it's like Russian roulette with my ass."
Yeah.
I told you I had that doctor at GMHC who was a researcher at Yale,
Yeah.
and he had all of these, awards and commendations.
Right. Credentials.
He was horrible at bedside
Yep.
manner.
Yep.
Horrible. Did not listen to you.
Oh, I hate that.
Tell
That
him
was.
this
Yep.
medication makes me really, really sick, to the point where you throw up or the other end, and like didn't care.
Right.
Didn't care until you say, "I'm not going to take it anymore. I'm not taking the medication." So
Yeah.
if you want to do something else, well, if you don't take the medication, then I said, "I'm not taking that medication." "Well, you have to because it might mutate, blah, blah, blah." I said, "I don't care."
You don't have to do anything.
I said,
It's your health.
Medication. It makes me sicker. That was a time when the first cocktail came out.
Right.
And so
Right.
I had watched friends die from the medications,
Yeah. Yeah.
from the
Because they were
AZT.
giving way too much.
Yeah, and the doctor didn't
Yeah.
care. The doctors didn't care when you said, "I can't take this because it
Right.
makes me throw up. It makes my life miserable. I have no quality of life." "Well, you still have to take it." It's like, "No, I don't care. Why don't you?" And I said to my doctor, "Why don't you take it?
And see how you like.
See how it makes you feel.
Yeah.
See that you can't keep something down. See that you need to be near the toilet at all times, making the toilet your best friend." I said, "Then you take it, and you should see how it affects you." "Well, I
Yeah.
don't have it." I said, "I know, you should still take it.
Yeah.
It's not going to affect your immune system, but it's going to make you sick as a dog."
Yeah.
And I said, "And there's no reason you should be sick." "Well, it's just, you're attacking the cells that." But I said, "Oh my God, that's such bullshit. That's such bullshit. It's way too toxic. You're
Yeah.
basically trying to kill your body so that it stops replicating these.
Right.
Uh,
Right. Right.
so I said, it's like these cancer drugs where it's worse than the cancer.
Yeah. Like
So,
prednisone. Yeah.
and then you have doctors who go against the grain. You know,
Right.
like the doctor I had in California who said, "Why are you taking HIV medication?" I said, "Because you have to." And he goes, "No, you don't." He goes, "If your T cells are this high and you're undetectable," he goes, "there's no reason for you to be taking it."
Wow.
So I asked
Yeah.
my doctor in when I got back to New Jersey if that was okay. And she said, "Yeah, it's actually good because you are on all the drugs have Crixivan in them, which gives you Crix belly and makes you
Mm.
lose the fat in your face." So she said, "If you go off it for 2 years and we'll monitor you to see if it has a
Yeah.
really
See if it has a side. If
right."
their T
She goes,
cells
"And then
go
you'll go
down.
back on it." She goes, "But if you can go off for like a year or two,"
Yeah. It's
she
good.
said, "probably by that time the medication will have improved because they're making improvements
Right.
every day."
Right.
So, and it turned out she was right.
Like we put doctors on pedestals and act like they can't be questioned or whatever, but they can, and you should. You know, I was the one time I was in the hospital, I had a nurse. She was great, and she listened and she said, "Here's how you talk to doctors or whatever." And she goes, "Here's the secret. So the interns have short coats. So the shorter the coat, the newer the doctor. So when a doctor comes in and they have a very short coat, you're talking to a brand new doctor or an intern who's just
Yeah,
starting. So look at the length of the coats in the hospital. You want a long coat doctor, not a short coat doctor."
yeah,
So
yeah,
that was like, oh, okay, interesting thing. So then when the interns came in, I listened to them, talk with them, obviously, but those are ones where I would like say, I'm going to educate you a little bit about some of the things that you're talking about that you might need to, like, when you're treating an MS patient, these are the things you need to know. There's a girl in my class named Kathy who I was friends with, and we're Facebook friends now. And she sent me a message and said her, I think her niece or her uh, daughter-in-law or somebody in her family had been diagnosed with MS, and she was just seeing a GP, and the GP was treating her for depression. And I was like, well, she might be depressed because MS is a pretty depressing thing, but
right.
she needs one of the MS meds. There's tons of meds for MS that young people, younger, she wasn't like 12 or anything, but she was like, 30
Yeah,
when a lot of people get diagnosed. Or I was diagnosed at like 32. That was about how old she was. But, so I was like, you need to make sure that they get a neurologist. She needs a neurologist. She needs her GP, but she needs a neurologist too. She needs somebody who really knows about what it is. So fortunately, my GP actually went, or my neurologist actually went to Wash U in St. Louis.
yeah.
So, and that's where she was. So I said, I'm going to ask my doctor, who to refer you to. And he just referred me to Wash U in general. He said there's a clinic there, and it made a huge difference. She got on the right meds. She's doing great. She doesn't need meds for depression. She's not depressed, clinically depressed. She's not, she's depressed, situationally depressed, which antidepressants can help with that, but that wasn't what she needed. She
Right.
needed the right medication for the MS so she could function. It pays to go to the specialist, or it does, it's a useful thing to have the specialist.
Right.
That's true for any of the psychotropic medications too. So, like when if a kid has ADHD, I will say you could probably get the meds from your GP because those are pretty clean meds. They don't have a lot of, like, they get in and they work and they get out. They don't like kind of accumulate and need like liver checks and all that kind of stuff.
Right. Yeah.
So you could probably get those meds from your GP. But for things like depression or even anxiety, I usually say if you can try to get an actual psychiatrist because they're going to know more about those meds.
Pretty much it for today. We're talking about doctors, insurance, being referred, being looked at by a intern or a group of interns, and the things you have to go through to get proper health care. And
Yep,
you are your best advocate. You
absolutely.
don't speak up, they will give you the minimum
Right.
of what you ask. So you know your body better than anybody else. So be sure to
That's
speak
right.
up and don't let people
And
tell you stuff that you know is wrong.
right.
Just find another doctor, no matter
And
how
they,
hard it
the
may be.
doctors do rely on you to give them a really good history. So
Yeah.
don't be afraid to talk about anything that you think complicates your situation.